This video project is on healthcare in the Israeli state by Jacob Zimmerman, Emma Vaught, and Lydia Armstrong for Human Health Sciences 356 with Dr. Scaff. Israel is a country located in the Middle East on the Mediterranean Sea. It is most well known for being the holy city to the world's main three religions: Islam, Judaism, and Christianity. The World Health Organization ranked Israel the 28th out of the world's top 100 best healthcare systems. Israel is also ranked the 10th healthiest country in the world by Bloomberg's Global Health Index. Israel provides its citizens with universal healthcare coverage. Health insurance was first required in Israel by law in 1995. The federal government reviews its insurance plans each year to see if there is any way to make improvements. Over the past decade, the quality of life and the quality of preventive services in Israel have significantly increased, therefore helping its citizens. The Israeli healthcare system is publicly financed, and the national health insurance system automatically covers all citizens and permanent residents. The healthcare system is funded in two ways: a special income-related health tax and an income tax based off of general government revenues. Employers are required to enroll all of their foreign workers in private insurance programs. This includes any undocumented foreign workers. Although all citizens are required to have their own health insurance program, private insurance is optional for tourists and business travelers. There are four main competing nonprofit health plans that almost all physicians provide care through. There are several ways to obtain an education as a healthcare professional in Israel. There are three options to study medicine. One is a full 7-year program. Another is a 4-year program offered to those who have already completed a bachelor's in completing medical school at an international school of medicine. Healthcare professionals such as doctors, nurses, psychologists, physical therapists, and occupational therapists trained in the United States require no additional training to work in Israel. However, there is a mandatory 3 to 6 month period where physicians have to become adapted to the Israel medical system. In order to practice medicine in Israel, you're required to hold a license issued by a specific division of medical professions. You also must complete either a 1-year internship in your specific field or clinical work. Culture greatly impacts the health outcomes of Israeli citizens. For example, Israeli Arab men are much more likely to develop lung cancer than Israeli Jewish men because of smoking habits. Approximately 55% of men and 41% of women in Israel are overweight. 71% of the population practices Judaism, a religion that can have effects on patient compliance within the healthcare system. Israel is ranked the 10th healthiest country in the world. 2/3 of all the deaths in Israel are attributed to heart disease. New environmental changes are creating concerns in healthcare that we have never seen before. Israel has a very low infant mortality rate and a very high life expectancy rate of 81 years old. Facilities in Israel have very modern treatment with up-to-date technology. Compared to the United States, Israel spends much less per person each year on healthcare. They spend about $2,000, while the United States spends about $10,000. On average, there are 3.5 physicians for every 1,000 people in the population. The United States only has 2.6 physicians per 1,000 people. In Israel, 96% of children have the measles vaccine, compared to 91% of children in the United States. 63% of Israeli citizens said that they were highly satisfied with their healthcare services, while only 55% of United States citizens shared the same satisfaction.
Yeah, so my name is Melanie Galarter. I'm a junior at UK. I'm studying equine science and management on a pre-physical therapy track with a psychology minor. So after my senior year of high school, I decided to take a gap year in Israel. I'm Jewish, so I feel really connected to the state of Israel, and so I decided to take a gap there for a year where I studied at a university in Jerusalem and taught English to at-risk youth. Finally, about 3-4 weeks into my program, I'm covered in bites. I look diseased. I'm so frustrated. I wake up in the middle of the night and I find bugs in my bed, and I had bed bugs, and the Israeli healthcare system somehow misdiagnosed me twice when, upon Googling, bedbug bites are very easily identifiable. So that was my exhausting experience with the Israeli healthcare system and the doctors that my program's insurance plan provided for me. Granted, they were English speaking, so they weren't native to the land of Israel. I don't know, but it was interesting. Yeah, so I was able to travel there for 9 months on a student visa, and then with my program and attached to my student visa was a student health insurance plan. Um, I would say that my healthcare experiences in America versus Israel have been slightly more positive, just because I think I was an odd case where I got misdiagnosed. I don't think that that's symbolic of the entire Israeli healthcare system. I think I just sort of got not the most reliable doctor, or he was a little bit overtired and too busy that day. I don't know. I wouldn't say that the whole entire healthcare system is at fault for that one misdiagnosis. I think that generally they're pretty far ahead in advance in terms of their scientific technology and medical advancement. So I think that their doctors would be generally pretty far along. Similarly, I think I just sort of had a bad case.